Let's call the meeting to order. We have a couple things to finish up from last time. Later this week, we're going to be taking up the substance abuse. And just for people's information, the topics that'll be posted as bills or drafts are we're not going to act on those. There's three bills I think we're taking up. One is March's policy bill. I'm not sure if the DHS one is ready yet. We're going to talk about moving behavioral health to a new agency, and then we're also going to talk about what's happening with the RCOs, recovery community organizations, and how they're approved. And so there's going to be a draft about that. That'll be posted as a SFXXX with language so people can discuss that. Those will be brief at the end of the time. We're going to put a lot of our time into hearing about the state of substance abuse. And so there'll be mostly written testimony about that. There may be some other testimony if we have time, but I want to get this out there early so people can start talking about it. Anyway, but beyond that, probably the marquee bill of the session is Senate File 2774, and Senator Uckey will move that to get it in front of us. There is an amendment. Mr. Monahan, is this the 7-8 one, 067-8?
Mr. Chair, I think we're experiencing a little growing pains. I'm sorry, what was the question?
So we should adopt the LM 067-8 as an amendment, or is that the bill?
No.
That's the
That
bill.
document is an earlier version of the language that ended up in the Senate file. I believe you don't have a paper copy of the Senate file in front of you.
Right, okay.
The amendment is the SCS 2774A2.
Okay. Well, good. So that's the base bill. So the council document is the base bill. So Senator Uckey will move the A2 amendment. Yeah.
So moved.
Thanks. And Mr. Monahan, we talked about this already. This is a technical clarification. This is going to go to the floor. And as announced, we're very interested in any details people find that are not totally just recodifying. There's supposed to be no new policy. Everybody understand that? Anyway, so all in favor of the A2 amendment, please say aye. Aye.
Aye.
And Senator Uckey will move that Senate File 2774 as amended be recommended to pass and be put on the consent calendar. Any questions about that? All in favor, say aye.
Aye.
Aye. Opposed?
Aye.
Thank you. Oh, yeah, it's the delay. So that's that. And then to the other one, which is Senate File 2876. And I'm trying to be as transparent as I can on this. This is a series of modifications. There is a delete all, right, Mr. Monahan? There's the A4, right. So anyway, so Senator Uckey would move Senate File 2876 to be in front of us. This is going to go to finance.
So moved, Mr. Chair.
Thank you. And the A4, this bill is still being worked through for the sake of those who had concerns about the minimum wage, sub-minimum wage, and the elderly waiver piece of this. Those are going to fall off the bill in finance. My word was we would take what we talked about, put it all into a big amendment. There may be some other small changes along the way. The plan here is just meant to be a consensus bill. I had a good meeting with the department about the child care piece, and we're going to try to sort that through and come up with a resolution by finance, and I'm open ears on that. So this is the amendment of our last time's work, subject to the changes we talked about. Senator Uckey moves the A4 amendment. Any questions about that? Senator Murphy.
Thank you, Mr. Chair and members. And I am just wanting to make sure I have the right pieces of paper in front of me. So if you could, I saw that, but I couldn't read it. So could you make sure that you're identifying what it is that we're acting on right now? And then my second question for you, Mr. Chair, is when do you anticipate that finance hearing to happen, where the issues that are not yet resolved would probably fall out of this bill.
It's the A4, I know that for sure. I have not talked to Senator Rosen about the next step. And just and so this is the early bill moving, and I was trying to play a little cleanup with some things that have been on our table. The House is interested in it being COVID-related. There still may be some things that are not controversial. This is meant to be a non-controversial bill as it leaves. If there's any other waivers we need to pick up along the way, I'll try to share those with folks so it's no surprises. It's actually the will of any of the, Representative Hortman, you may remember her, she's interested in a COVID bill to move fast to show that we're working together, and I'm all for that as well. And if you can pick up a few riders along the way that just need a little hitching ride. There's an issue with the substance abuse, some technical things about that which may snag up implementing some of our rate increases and so on. So is that helpful? Okay, with that, all in favor of the A4, say aye.
Aye.
Mr. Chair.
Oh, I'm sorry. Did you have your hand up? I'm sorry, Senator
I
Wickland.
did.
It's really hard
Thank you.
not having you here in person. I apologize. So
I
Go ahead.
understand that. So I guess I was going to ask, and it sounds like it won't be necessary then if you were planning to have a fiscal note done, but are you saying then that anything that has the items that you mentioned that aren't going to stay in past finance, are they going to be fiscal noted, I guess? That's understood?
Oh, sure. The two topics in particular, the sub-minimum wage, there's some controversy to that, not for me, but it's, I think at least, well, more than half of us here like that amendment. But I think it needs to be worked through a little bit in working with the House, and even adding on people onto the committee, the task force, will cost money. So there's a policy question as well as the money question. I think posted in today's agenda is the fiscal note for the technical fix to the elderly waiver thing, which costs $3 and $13 million, so it's far beyond technical. It's my interest in I was hoping to advance that now, but I don't think it can be worked out, and I don't think the House wants to put that on this bill anyway. So we'll visit that again to make it workable. So does that help, Senator Wickman? I'm sorry I missed you. I'm happy you shouted out. So is that
Thanks.
helpful to you?
That helps. Today, not having that information before the hearing, I was planning to, speak a little bit about those two items, having some concerns about them. I still have concerns about the task force language, and I have concerns about the other elderly waiver provision. Basically, we haven't had a lot of discussion about that.
Right.
But I understand that, what you're planning to do. And I guess in terms of the one item that you didn't include in your A4, the CCAP, the absent days provision, I just want to make clear that I strongly support including that. And I understand that you're saying that you're going to have more discussion about that topic, I'm assuming. And I hope that you'll keep in mind that this is a provision that would help providers who are basically small businesses, and allow a lot of them, family child care providers and centers that are not large. And it allows them to continue functioning during times when we have uncertainty in their business, where they have to quarantine, people have to quarantine, families have to quarantine. And so I think since it doesn't have a cost, I think it should be included, because it is something that will help stabilize these businesses from that period, November, when the Omicron surge began, and people had to take more time away, and then continuing on into January. And even now, people are facing that. And there were two items that you did include, posted, a letter from a provider who has been dealing with this, and the provider has predominantly children who are using CCAP subsidies, and this, she indicates, is what is allowing her to sustain her business during challenging times. So I think that you really, I would strongly support or strongly urge you to include that when it comes out of finance, so it can go back, go on from there with this provision in it. I wish we could do it today, but I understand that you're going to have more discussion about it. So, and this is something that will affect providers all over the state and families all over the state. So that's my 2 cents on that particular topic, and I hope that you have a productive discussion after this hearing then.
Well, and I appreciate that, and I've been trying to provoke exactly the discussion we've been having. I've already had a great discussion with the department. They've enlightened me a bit. There's the 70 million, the 20 million. Both of us were written without much input from the legislature, and that continues to disappoint me. And so as we write this together, we can find a way to do the most good. I just want to remind everybody that the streams of money falling from the federal government are going to be, the showers will be ending. They're at $30 trillion in debt. So we just need to find a way to stand on our own in our own departments. And so I think that's a really good discussion. So, I think we've made it clear. Any further questions from members? And shout out if you're online and I didn't see you. Okay, with that, all in favor of the A4 amendment, say aye. Aye.
Aye.
Opposed?
No.
No.
Okay. Thanks. The motion prevails, the amendment's adopted. So Senator Aki renews his motion that Senate File 2876 as amended be recommended to pass and go to finance. All in favor of that, say aye.
Aye.
Aye. Opposed? Thank you. That's on its way. And I appreciate the process, and thank you. So to the governor's crew here, I'm always eager to hear about the governor's budget, and he never comes to present his own budget. I don't know, all these years, Senator Murphy, there's never a governor in that chair. Well, there's actually nobody in that chair. There's nobody in the chair. Senator Murphy, would you like to sit in the chair? Oh, there we go. Anyway, so the governor has put forward a budget that's optimistic, shall we say, and we have people to testify, and and so with that, we're going to go to Commissioner Harpstead, who is on TV. So welcome to the committee, Commissioner, and so we're going to stop for sure by 2:45. So in my interest, if it makes sense, it looks like there's different clusters here. So maybe we'll take questions at the end of each cluster. So if we can just listen for that, and then clarifying questions, and then I'm not sure how much time there'll be for a discussion, but this hour and a half is dedicated to that project. So Commissioner, welcome to the committee.
Thank you very much, Senator Abeler. We have a presentation to put up. Thank you. So grounded in their vision for One Minnesota, Governor Walz and Lieutenant Governor Flanagan's proposed budget to move Minnesota forward is a balance of key investments in 4 main categories: local jobs and projects, expanding economic opportunity, supporting kids and families, protecting public safety. Next slide. This shows you that the DHS-oriented pieces of that budget add up to $484.6 million in the first biennium and $1.742 billion in the second. And you can see how this breaks out across the many accounts that intersect with our work at DHS. Next slide. The governor's supplemental budget includes proposals that address the challenges we face today while investing in the future to ensure we emerge from this time of crisis stronger than ever. The DHS budget is a mix of new investments in priority areas, as well as funding to make sure basic services, such as our direct care and treatment programs, have the support they need. And these are the categories, buckets, whatever you call them, that we'll be presenting in today. And so I will do the first proposal here about our caring professions workforce. And Senator Abeler, I have to say, you and I have talked about almost nothing but this for the last couple of months, and here is the proposal. The governor recommends revitalizing the state's behavioral health, direct support, and housing workforces by establishing a workforce incentive fund. This fund could be used to offer additional compensation, including but not limited to retention payments, hiring bonuses, and financial assistance for post-secondary education, loans and scholarships, for example. Employers in these industries who would be allowed to apply for grants to deliver these incentives to employees who have been employed for 6 months or longer. And eager to see us move this forward if we can, so that we can keep these caring professions caring for up to 30% of the state's population. Thank you very much. Yes.
Hi. Well, I appreciate this material you've got. Is this all the detail there is on it? Well, very often there's like a budget page which has like who's going to get what and so on. Is this all the detail you have for us today on any of these?
Mr. Burdick, do you have additional detail that we're submitting to the committee?
Yes, thank you, Mr. Chair. Matt Burdick with the Department of Human Services. We will be issuing our full budget change pages, and I believe you should also have the paragraph summaries that MMB has released, but the change page narrative that you're used to will be out later this week.
All right, I appreciate it. Maybe we should have waited for that. But, and so if I don't know how to say this, but, you know, these have been out, so if maybe who's ever going to discuss each topic can just kind of give a little summary of what it says and just not read it to us, I would appreciate that. So you'll actually hold my attention better, I know. And, you know, we've been talking to Comcast and those other places. We need to keep our viewership high. So anyway, so thank you, Commissioner. If you don't mind, and just summarize, it'd be good. Because then we have more time to talk about it.
Okay, thank you very much. I am finished, and I believe Assistant Commissioner for Community Supports Administration, Gertrude Matemba Matassa, is prepared to go next.
Thank you, Commissioner, and thank you, Ms.
Well, actually, let's just, so I just thought we were doing slides. Why I got a list of things. But so you're just talking about that first one then?
Yes.
Okay, well then, we're going to take it by, this actually counts as a section.
Okay.
Do you have a more, I realize the pages are coming, but can you give us an idea about how you might spend this? There's over 200,000, if, I don't know if you have hospitals in here, but there's over 200,000 people, and probably more than that, probably 300,000 people in this pot of people. Can you give us an idea about how you're going to pass the money out and what you hope to get for it, please?
So first of all, this particular proposal is limited to the DHS licensed organizations, and actually includes disability services, older adult services, behavioral health services, and home care services, and does not include health care or child care, which would be covered in other proposals from other agencies of the state. This is a general bucket, if you will, of incentive money that's fairly flexible in terms of employers being able to use it in ways that they think would be helpful, whether they're hiring or retaining bonuses, or actually paying for childcare, or supporting college costs. And we need to see how this goes before we figure out the formula for how we would distribute it across the providers in Minnesota. So that's, that detail is
Okay.
yet to be worked out.
Well, that's a good start. And I think there's something like 200,000 folks in that bucket, it seems, by my understanding. So, Senator Murphy.
Thank you, Mr. Chair, and thank you, Commissioner. My question has to do with the limitations on the incentives that employers would be able to use. And if there are limitations on the ways in which employers might use this funding with regard to their employees. And I also am curious to know if the money that you're identifying here for employees could be used for wage increases in addition to hiring or retention bonuses. Now, I am clear that we have workforce shortages, and we hear that in industries all across the sectors. And it seems to me that if we want to retain workers, we need to pay them more. And I'm wondering if employers getting this funding would be able to pay their workers more in addition to a bonus. Thank you.
Commissioner.
Thank you, Mr. Chair and Senator. This particular proposal contemplates only incentive payments, not wage increases. I think we need to have a conversation this session about wages and where that all heads as we look at retaining workforces in various sectors across Minnesota. So it's certainly a valid conversation for us to all have. But this particular proposal is incentive-based. We've tried to make it very general and very open to what employers think they might need and what they have found might work for them. There is this one restriction that people need to have been employed for 6 months or longer. So for example, an employer could have a stay bonus that if you join us and stay for 6 months, here's your incentive. And if Elise Bailey is with us from our budget area, I wonder if she has any more thoughts about the answer to that question.
Yeah, Ms. Bailey, welcome. Nice to see you again whenever I see you.
Thank you, Mr. Chair. For the record, Elise Bailey, Budget Director for the Department of Human Services. I would echo the Commissioner's statements about how we do acknowledge that wages are certainly an issue across the entire spectrum. I think with this proposal, we are really looking to have a flexible use fund for providers to apply to have a variety of incentives that they could provide their workers that would really work for them. So it could be hiring bonuses or retention bonuses, but also to pay for schooling for their workers, for transportation costs, or even the childcare costs for their workers. So a really flexible pot that really tries to get at incentivizing kind of retaining their workforce in really creative ways.
Senator Murphy.
Thank you, Mr. Chair, and thank you, Ms. Bailey and Commissioner. The only thing I want to add to this, and I appreciate the thoughtfulness with which you are approaching this, but if we have workforce shortages across sectors, I think we need to think about how we're retaining people beyond a bonus. We know that these critical sectors that you're talking about, caring for people with disabilities, people who are aging, we know that it's hard physical work, we know that it's hard emotional work, and we know that people leave those jobs for other positions that are easier and pay better. And if we want to retain a workforce here, which we need to, I do think that we have to look beyond retention and hiring bonuses. I do appreciate childcare and education as a part of this mix. But right now, I think we're going to see people chasing positions for bonuses because bonuses are the things that employers are using, and that doesn't help us retain a skilled workforce, which is what people with disabilities and people who are aging and need support need. They need a skilled and familiar workforce. And so I just want to make sure I'm on the record that I think that this by itself is not going to solve the problem for us, and I'd love to continue to work with you. Thank you, Mr. Chair.
Well, thank you, Senator Murphy. And Ms. Bailey, maybe we're going to come to it, but is there some other proposal in here to address the concerns Senator Murphy had about supporting an ongoing workforce and wages and whatever things may be needed for the future?
Mr. Chair, this current budget does not include any wage increases or rate increases for this industry, but the department and the administration would be happy to work with you on technical assistance around those ideas. Well,
I appreciate that, and thank you. So I appreciate the discussion, and so let's keep moving. And so now, Ms. Witemba Matassa, so we're going to let you kind of run through your things, and just even sometimes a one-sentence summary of it will be useful. A lot of the committee members are pretty versed on some of these topics, and then we can have a nice conversation like we just had with Senator Murphy. So, Ms. Witemba Matassa, welcome to the committee.
Sure, Mr. Chair and committee members, my name is Gertrude Witemba Matassa, Assistant Commissioner for the Community Supports Administration at the Department of Human Services. I will start out with the first proposal where the governor recommends $26 million investment to expand children's inpatient psychiatric and psychiatric residential treatment facility beds. This funding would be issued through a competitive RFP designed to allow hospitals and mental health providers to retain, build, or expand existing facilities to add beds for kids in need of acute high levels of psychiatric services. We project this would add about 100 beds. On the next proposal, the governor recommends that we direct access, that we excuse me. Direct access removes the current county and tribal placing authority and Rule 25 assessment with a streamlined process to improve access. This process allows people to seek an assessment, which is completed by a clinician who would confirm medical necessity and approve funding for treatment services through a medical assistance, fee-for-service, and behavioral health fund.
Ms. Matemba Matassa, I can't find where you are on the sheet. The next thing I had was healthcare affordability after the workforce thing. Can you tell me what page you're on so we can just follow along?
Yes, yes.
And if the
So
different speakers jump around, just tell us where you're starting at, please.
the substance use disorder, direct access, that's
So
the
what-
slide. I don't have the page number.
Oh, yeah, so we have this thing here that you provided to us. If you could just, if Mr. Burdick or somebody could just tell us what page you're
Yeah.
on, otherwise we're
Matt,
just gonna not be able to follow as well, so.
Sure. Matt?
Yeah, thank you, Mr. Chair. I can do that as we move along here. The slide deck unfortunately does not match perfectly
Right.
with the MMB documents, but we'll make sure to match those up for you. You might not be able to do so in real time.
Well, no, I don't mind that it doesn't match. I just would like to know what page you're on. Somebody said page 27. Does that sound right? 'Cause there's 5 things on there. And are you just kind of highlighting a few things, or are you going through every one of these points, Mr. Burdick?
Mr. Chair, we are highlighting the items that are germane to your committee. Part of the challenge here is that the various committee jurisdictions don't necessarily line up. So the document you're looking at from Minnesota Management and Budget has the full governor's budget recommendations for DHS. Our presentation today just goes over those proposals that are in your committee. And we'll do our best to match out and refer back to those.
29. So it sounds like we're on page 29. So that would just help. I'm not trying to be uncomfortable here. I just want to be able to follow. So go ahead, Ms. Matemba Matassa. Thank you.
Thank you, Mr. Chair. So DHS began implementation of direct access in November 2020 while leaving in place the existing Rule 25 assessment and referral process using counties and tribes as placing authorities. This parallel process has allowed time for both DHS and SUD providers to transition to direct access, with full implementation becoming effective on July 1, 2022. DHS has a federal 1915B waiver, which allows the state to waive a person's choice of provider. And that authority expires on June 30 of 2022. So we will no longer have authority to continue the placing authority model. The Centers for Medicare and Medicaid Services have requested DHS move to allowing choice of provider for SUD treatment services and have indicated they are no longer willing to continue extending the waiver. And so with this proposal, we will remove obsolete reference to Rule 25 assessments and updates to align with comprehensive assessment and direct access changes. We'll maintain the current county tribal administrative allocation to continue to support lead agencies in facilitating eligibility determinations. And it also included in this proposal is the addition of definitions for outpatient and intensive outpatient levels of care that align with ASAM standards. Next slide, please. Next slide. Okay. There is a need for more intensive community mental health services for children. Intensive treatment in foster care is a medical assistance intensive service available to children with significant mental health needs in foster care or in need of residential or higher level of care. It includes a bundled set of services including psychotherapy, psychoeducation, clinical consultation, and crisis assistance. This proposal expands eligibility for the intensive treatment in foster care, or commonly known as ITFC, to include children who are currently living with their families in community, but who are at risk of out-of-home placement or needing residential services or a higher level of care. Thank you. Early treatment and intervention is critical when it comes to psychosis. In Minnesota, there are currently 3 first episode psychosis programs with capacity to serve about 140 individuals. This proposal invests $1 million to create an additional first episode psychosis provider site to help improve access across the state. In addition, this proposal also addresses emerging mood disorders. Mood disorders are treatable, and early intervention is important and increase the chance of a successful recovery. The proposal invests $1 million to create an emerging mood disorder program that uses evidence-informed interventions for youth experiencing an emergency mood disorder, emerging mood disorder. It also creates a public awareness campaign on the signs and symptoms of mood disorders. Next slide. The governor recommends some reforms around adult day treatment rates. Adult day treatment is an important community service that often serves as a step-down stabilization service for people leaving more acute care settings, such as hospitals or intensive residential treatment. This proposal would increase adult day treatment rates by 50% to better sustain available day service providers and to keep people stable in living in the community. This proposal would invest a little over $7 million to increase the base funding for transition to community initiative, effective fiscal year 24 to 25. This increase will extend on a permanent basis the temporary increase approved by the 2021 legislature and provide ongoing funding for staffing. The transition to community grants help people transition from more restrictive settings such as Anoka Medical Regional Treatment Facility and other hospital settings to community-based settings. The grants help fund supports to meet people's unique support needs to thrive in community. In addition, this proposal invests $12 million in fiscal year 24-25 to increase the base funding for adult and children's mobile crisis services, effective July 2023. This increase would extend on a permanent basis the temporary increase approved by the 2021 legislature and provide ongoing funding for staffing. This funding will permanently strengthen the state's mobile crisis infrastructure and help improve access to crisis services by supporting counties and tribes to staff 24-hour crisis lines. It will increase capacity to allow teams to take more calls. Mobile crisis teams provide a Medicaid billable service. Grant dollars fund underinsured and uninsured individuals, as well as critical infrastructure costs and additional ancillary services and expenses that are not Medicaid billable. Okay, this proposal invests $545,000 in fiscal year 23 and $760,000 per year beginning in 2024 to create mobile transition units focusing on adults and children in emergency departments and inpatient hospital settings. The mobile transition units will focus on adults and children who no longer need a hospital level of care and assist them in transitioning to a lower level of care, including psychiatric residential treatment facilities, group homes, or foster homes. The mobile units will also support hospital staff and families in transitioning adults and children to community-based services. In addition, this proposal invests $250,000 to strengthen and support person-centered discharge planning process for adults and children discharging from PRTFs, CABs, and hospital settings. This proposal provides additional funding for PRTF startup grants to support additional providers coming online, as well as newer providers who need funding to make payroll and offer much needed services to children while they're going through the early phases of licensure, certification, and accreditation. The proposal also expands the allowable uses of startup grants to include emergency workforce shortage eligible activities. Children's
Senator
mental
Hoffman.
health.
Thank you, Mr. Chair. I wonder, Assistant Commissioner, if you could, as you're talking about the startup grants and is there conversation, one of the things that we keep hearing is there's this inconsistency, or not the word that I want to use. There's a disconnect between the licensing side and the process services side. How are you addressing that component when you're talking about giving these startup grants? Who's providing the technical assistance? Who's helping somebody wade through the fact that you have different agency responsibilities in there? And I guess maybe you've got it embedded in your proposal, but I just kind of like to hear from you how you're going to assure that so that it's a seamless transition for people.
Ms. Watemba Matassa.
Mr. Chair, Senator Hoffman, as you've correctly said, the process to become a psychiatric residential treatment facility is complex. And part of that complexity is based on the fact that the federal government has authorities in two different agencies. So part of it is in Human Services, part of it is at the Minnesota Department of Health. And so what we have in the Behavioral Health Division is a team whose main purpose is to provide technical assistance to psychiatric residential treatment providers who are coming online. And what that looks like is that we literally walk them through the whole process from the beginning to the end. We help them troubleshoot. We contact sometimes MDH on their behalf. We coordinate with licensing within DHS just to make sure that the process is simple. The good news is that we're typically dealing with one provider at a time, so we do have the capacity to be able to provide this service in a very intentional and meaningful way. One of the things that we have learned is that providers who have come online in the past few years have told us that there is a gap sometimes between the moment that they become licensed and they start serving children and when they can actually receive their first payment. And so this grant funding is really designed to close that gap.
Senator Hoffman.
And thank you, Mr. Chair, as a follow-up. So I understand, I guess one of the things is, Senator Abeler, that there's a work group. You know, I know Christy Grauman talked, there's a work group trying to deal with the transition side of this stuff, which is really good. Yet, is it a fair question that do you happen to have with the Department of Health involved, is there, because you got some Medicaid stuff going on between, is there an interagency agreement between DHS and the Department of Health that helps access the funding provisions that would possibly be there? And does that interagency agreement also spell out the roles, responsibilities? Because again, I'm going to tell you what I'm hearing from people is that, Senator Avery, there's still this siloed approach in that, oh no, that's not my responsibility, that's licensing side, but oh, that's not my responsibility over here. And so I'm glad to see that the department is wanting to put some money into trying to make this seamless, you know, for especially children. I mean, we're talking, you know, some really good services, but I guess I'm just not hearing that in the presentation, and maybe I just need to.
So, Senator Hoffman, is your question about the interagency agreement?
I think so.
And the money. Okay.
Yeah, Mr. Yeah, thank you.
May I proceed, Mr. Chair?
Yeah, please do. I tried to call on you. I don't know if you heard me. So. I don't like this Zoom. This Zoom is not as good as you sit in the middle there talking to us. And I mean, it's nice you're here, but anyway, someday you all can come visit us. I hope that at some point that we can have agency people sitting us. So we're kind of distanced here. There's like, in the room, there's probably not even 8 people. plus the people at the desk. So anyway, that's not your problem today, but anyway, Ms. Matemba Matassa, please, about the interagency agreement to spend money.
So, Mr. Chair, if I may clarify that you would like me to address the interagency agreement?
Well, just in brief, just that there is one and you can use that to spend money from Medicaid, I guess is the question.
So the interagency agreement or arrangement that we have right now it's a work group designed to figure out how do we make this process simpler for providers who are coming online. And right now, we have really been focused on meeting on a regular basis and trying to iron out some of those kinks in the system that makes it a little bit challenging and extends the time that it takes for a provider to come online. That's as far as we've discussed the issue around PRTS and the interagency communications.
Yeah, that's good enough for now. And so you answered the question as well as we can say it, but I think there's more conversation to have, and we're just going to have to move on. There's so much content, so maybe we can come back to that. So just all the body language that you get to have when you're having a dialogue with somebody, none of it's here. So if I come off as abrupt, I don't mean to be that today. It's just, I'm tired of Zoom. So anyway, Ms. Matemba Matassa, continue on with your next thing, please.
Thank you, Mr. Chair. Moving on to the next proposal. Children's mental health respite grants are available to counties and tribes to support respite for families of children with emotional disturbances or severe emotional disturbances who are at risk of needing a higher level of care or residential treatment. The purpose of the Children's Mental Health Respite Care Grants is to provide the parent or caregiver a temporary break to reduce family stress and to promote family preservation. This proposal defines the scope and flexibility of expenses that would be allowable under the grant to also include respite for children who are already in out-of-home placement and at risk of change in placement or a higher level of care. This proposal also allows funding to be used more flexibly for the following uses: recreational, meaning sports, non-sports, extracurricular activities and programs for the child, such as camps and clubs. Family activities, camps, retreats for the whole family, culturally specific activities, and costs of transportation, food, supplies, equipment, directly associated with approved respite care services, and expenses necessary for the child and family to access and participate in respite care services.
Okay, keep going.
The shortage of hospital beds caused by the pandemic, coupled with an already inadequate mental health service continuum and workforce shortage, have highlighted the need for more community dialogue. A community of practice is a way to facilitate dialogue. This proposal invests $250,000 per year, starting in fiscal year 2023, to establish a community of practice to support children and their families by facilitating a learning community to build partnerships and share best practices between families, advocates, researchers, and treatment providers. Funding will be used to contract with a consultant to assist with this work and to pay reimbursement for participant families and youth over the next 2 years.
Okay.
The Early Intensive Development Behavioral Intervention is Minnesota's MA autism benefit for kids and young adults. EIDBI providers are reimbursed based on a tiered set of qualifications, level 1, 2, 3, etc., which includes education and experience criteria. Some providers are eligible to receive a higher reimbursement rate if they are fluent in a non-English language. The underlying policy goal of this allowance is ensuring culturally responsive EIDBI services. However, we've discovered that an unintended consequence of this law as written is that it largely precludes American Indian providers from receiving the higher reimbursement, since through no fault of their own, many tribal members are no longer fluent in unique language. This proposal specifies that American Indian EIDBI providers, regardless of non-English language fluency, would also be eligible to receive the higher rate. And I have a couple more. Okay.
Oh, you have more? Okay. Well, keep going through your chunk, and then we'll talk about
Yeah.
a few things.
We're almost there. We have a couple more.
That's fine, thanks.
Okay. All right. Let's start. This proposal ensures that transition services will be available on an ongoing basis under the Housing Stabilization Services benefits. This proposal allows funds to be used for payments of up to $3,000 per person annually to cover costs associated with moving to a community setting, costs that are typically not covered by other sources. The proposal also extends the Housing with Support for Adults with Serious Mental Illness, commonly known as the SASME program, to provide supporting services to people with a substance use disorder who are homeless, long-term homeless, or exiting institutions who have complex needs and face high barriers to obtaining and maintaining housing. It also expands the PATH program, which is the Projects for Assistance in Transition from Homelessness program, to include people with substance use disorder who are experiencing homelessness, to engage them in services and assist them to access sustainable living in the community. The last piece that it does is that it directs additional funding for community living infrastructure program. This program extends the base funding, so the investments made by the 2021 legislature are ongoing. The community living infrastructure program supports counties and tribes to meet housing-related needs of people who face barriers in transitioning into the community. And the program expansion allows grants to be used to provide direct assistance to individuals, including funds for lease or rent deposits, utilities and setup costs, including telephone and internet services, as well as essential furnishings and supplies, and costs related to expungement of records, including filing fees and attorney fees. And my last one, the Homeless Management Information System database supports programs across state agencies serving individuals experiencing homelessness. It helps the state track outcomes and identify the better ways to target resources. This proposal includes increased funding for the ongoing maintenance and improvement of the Homeless Information Management System. This proposal also addresses the AmeriCorps Heading Home Core Initiative, which is a new service program that was launched in the summer of 2021. The program recruits people to work at sites across the state as housing resource navigators to help Minnesotans work towards safe and stable housing. The funding supports up to 100 AmeriCorps members each year. It secures the state match funding to support the ongoing effort and to ensure program sites do not have to pay increased fees. And last but not least, it also funds a study to assess the workforce needs in emergency shelters, transitional housing, street outreach, and site-based housing for long-term homeless supportive services. This study is needed in order to assess the workforce for these vital services and to determine future solutions to workforce challenges. And I'll hand it over to my colleague, Assistant Commissioner Tiki.
Well, not so quick. So now this is the end of a segment. So if people have questions about what we went through, this is a good time for that. I have a number, but if other members have questions. Senator Benson.
Thank you, Mr. Chair. I wanted to ask, Ms. Matemba Matassa, it's very nice to meet you. Wanted to ask which of the additional programs that you are proposing meet results first criteria?
Ms. Matemba Matassa.
I'm sorry, Mr. Chair and Senator Benson, can you please repeat your question because I'm not sure I'm following or understanding your question.
Senator Benson.
We've been trying to increase the usage of best practices and the results first inventory that's done by MMB in conjunction with Pew Research is a good good place to start. And so if it's not been proven effective by somebody in the Pew inventory, one of another state that uses the Pew inventory system, can you tell us about where it's been demonstrated effective, what other states it's been used in being demonstrated effective in achieving the outcomes that you seek? And we know we need expanded mental health beds in Minnesota just to deal with the emergent care. But on some of the other issues, substance use disorder and mental health services that are expanding, can you tell me where they're proven effective either through Results First or another state that implemented them?
Ms. Mutemba Matassa.
Yes, Mr. Chair and Senator Benson. So when we look at effectiveness, I will start out with substance use. We look specifically at ASAM standards. And these are the nationally established standards of care that Minnesota is adopting. And I think that's the short answer. ASAM standards, these are the American Society of Substance Use Disorders. And so that's really where we look. We look at other states. I wish I had all my sources here in front of me. But typically, in order for us to adopt something, we look at the clinical data. If the data show that, this is something that's proven to be effective from a scientific perspective, then we adopt it. And as an example that I just gave you, ASAM standards are really one of our go-to standards, particularly as it relates to substance use.
Senator Benson.
Mr. Chair, I'm just trying to find evidence of support, because if we're looking at expanding programs, we either need to take it from existing programs that aren't effective and aren't meeting the standards that either Results First or ASAM are holding. We just keep adding things to the inventory of services, and we never look at, is what we're doing effective? Are we changing it? Are we getting rid of something? Or are we just piling on? So I'd like to see data-driven information about why investing the next dollar is the effective way to help people deal with chronic mental illness and substance use disorder.
Thanks. And just maybe if I take the risk of summarizing your question to the department, I realize that's maybe a challenge on all these items here, but the ones that you're particularly interested in hoping that we'll really do, I think for us to really consider any additions, we really need to know that it's going to work. And so first, Results First is, I think, way underutilized. I think it's the future in deciding how to handle. I think it's $46 billion our committee turns into by next biennium. $46 billion in the biennium, and nobody thinks they have enough money to do anything. And so we want to make sure we serve our people. So other questions from members? I have just a couple. And so, I have a lot of questions, but just a few, and you don't have to reply to this, but the EIDBI program, a lot of us celebrated how that would help some of these young people with autism and to have early interventions, and it's been nothing but snags along the way. And barriers put up that we didn't even mean to make hard barriers, the background studies, which we thought made sense. It's become a barrier, and you're kind of working through that, I guess. But it's been a long time taking off the ground to serve these kids. And there's 10,000, at least 10 to 15,000 children who would benefit by this, that when they pass through their early childhood window, they are never going to have the opportunity to get the benefits of that, and they will suffer over their lifetime. And I'm just going to ask, I don't believe it's simply the rates that keep people from using this. I think it's a burden of the program. And I'm happy if you believe, and don't answer that now because we have no time, but just that, I think the tribes should be able to get the best benefit of that they possibly can. But I will predict if you raise their rates, it's still not going to help the uptake because of the friction in the program. And I had just, and so of course we're always wondering about FTEs, but I'm curious, how do you ever think you're going to staff all these programs that are being set up here with human beings since we can't staff our current programs. The PRTFs, pick any of the ones where you're generating a program where you have to site it, have to staff it with people. Have you thought about that? And maybe that's rhetorical and it's not meant to be an embarrassing question, but I think it's a very real question. So Ms. Mutemba Matassa, do you want to comment to that? And I'll let you pass if you'd rather, so.
Yes, Mr. Chair. So the workforce shortage is really real. And we know that it's real because we experience it in our own lives, and when we work with providers, we know that this is real. So I'll answer the question on two fronts. The first front is the FTEs that we're requesting for DHS, and then the other piece that you're talking about as it relates to workforce is how do we address the workforce issue as it relates to our providers. And so I want to say that as we have been hiring at DHS, even during the pandemic, even now, we feel encouraged that people have probably found some sense of meaning during the pandemic or something, because we're finding that we're getting quite a few applicants for the positions that we have open. And as it relates to our providers, this is an issue that is not a simple issue. There isn't a simple answer to what we're going to do about the workforce shortage. It's going to take many, many discussions on many, many levels in our state to be able to solve this issue. And so what we've committed to is that process of ongoing discussions. You will see that DHS is going to continue to be committed to having these discussions about, some of it could be rate increases, some of it could be a variety of things, which I'm not qualified to address as an individual. But again, committing to that ongoing discussion on such a complex issue.
Well, thanks. And so we had we had a ton of money last time. We bought a whole bunch of new programs. And I think we'll have a hearing sometime about the progress of how those are being stood up. But as we open up new programs, and like there's 300 beds in the PRTFs, well, how great that would be. Well, that's not going to operate with 5 people. Like you have 2 FTEs to coordinate it from your end. But I'm just remain concerned, and I didn't have you come up here to be unkind. I'll leave it at that. So Senator Murphy.
Thank you, Mr. Chair. And I did have one question about the proposal that's on page 8 of the slide deck, and that has to do with additional inpatient psychiatric beds for kids, and wondering if you have a path for implementation regarding that, and if it has an interaction with the proposed expansion at the Children's Hospital in St. Paul.
Ms. Mutemba Matassa.
Mr. Chair, Senator Murphy, so our hope is to build a strong continuum of care. And it begins with a vision to give hospitals the opportunity for those that are interested and capable to expand their current offerings using their current infrastructure to include more inpatient psych beds and maybe even some outpatient. That would be a really good thing for our state if that happened. In addition, we currently have standalone psychiatric residential facilities. And so when we think about this proposed funding that we've put before you today, we really think about it from helping to expand the capacity of hospitals to build out the entire continuum of care, to include acute beds, psych beds, as well as some outpatient intensive services for children. At the same time, also potentially supporting the standalone psychiatric residential facilities so that they can expand their capacity to take in more kids as well. That's how we're looking at this as we think about the entire continuum.
Senator Murphy.
Thank you, Mr. Chair, and I appreciate that. I have been to the St. Paul Children's Hospital and am familiar with what they are thinking about there regarding inpatient beds. I am curious about, and I'm not an expert on the moratorium or layaway, but if this proposal would displace other beds that are currently in place, or if this is an expansion of beds from your perspective. And if the proposal at the St. Paul Children's Hospital would fulfill what it is that you're envisioning, or if that is additional, if that's another proposal that we'll be considering down the line.
Senator Murphy, did you want to reply?
Mr. Chair, I would love a reply unless it's too complicated, and I'm happy to wait for it.
Okay, well, Ms. Mutemba, that could be the last word in this section, perhaps. So if you want to reply, Ms. Mutemba Matassa, or it's up to you if you want to take it offline.
Mr. Chair, Senator Murphy, the idea is to expand. And we have actually had conversations with Children's Hospital, and their goal is to really add, because as you know, right now, they do not have any acute psych beds. And they're finding that kids are getting stuck in their EDs because we actually have a shortage of psych beds across the state. And Children's Hospital currently does not have psych beds. And so the idea is to add and expand their continuum of care and not displace the current beds that they have.
And
This
Senator,
is on.
oh, thank you. And so you can begin to change hats here. Senator Murphy, you know, and the world has changed so much since you and I came into this place in the healthcare world. We're down to a handful of health plans and a very small number of very large health systems. Maybe you and I should talk about why do we have a moratorium anyway, and who should be deciding that? A few people in a boardroom deciding they're going to expand or not, or deprive people of care, and maybe if there was a market, like, how many do you want to make? I don't know. Can you make them pay for themselves and, you know, maybe be nicer ones? Remember the arms race, we're happy to have a moratorium, but that arms race is gone, and now it's kind of the race to the bottom almost. So I'll be happy to, let's talk about that some more. Senator Murphy.
Thank you, Mr. Chair. I'd be happy to engage in that conversation with you. It's something I've been talking with Mr. Monahan about a little bit. And the conditions under which the moratorium was put into place are much different now.
Yeah.
And it would be worthwhile dusting that off and taking a look.
Yeah. Some good ideas never really go out of favor. So who's next? Welcome, who's ever brave enough to come next to this TV.
Hello, committee members and Mr. Chair. My name is Tiki Brown. I'm the Assistant Commissioner for Children and Family Services.
Well, welcome to the committee.
Thank you so much. I'll be presenting on the governor's budget recommendations related to economic assistance, child care, food security, and child welfare. But first, I'll round out the homeless and housing recommendations right now. So these are actually on your pages, if you're looking for the references, on pages 22, 30, and the top of 31. So this proposal addresses homelessness for Minnesota adults, youth, and families, providing additional funding for the Emergency Services Program to increase shelter capacity and services across the state, expand funding for the Homeless Youth Act, increasing the number of housing units for youth experiencing homelessness, and finally providing additional funding for a transitional housing program, which would increase transitional housing, wraparound services, and prevention programming to ensure that families don't stay entrenched in housing instability generation to generation. And with that, I'll transition to economic assistance. The first is a budget proposal, has a series of recommendations aimed at addressing deep poverty by closing service gaps in the state's cash assistance programs and ensuring that people are supported to live in dignity and to have better health outcomes. Specifically, we are looking to index general assistance or GA benefits to the Minnesota Family Investment Program or MFIB, which would raise the maximum general assistance benefit from $203 per month to $344 per month and tie the value to annual inflation estimates. It also ensures allocations are fair and meet local needs. And it also allows a reasonable amount of time to complete Social Security disability applications, as well as ends the practice of assessing overpayments to cash assistance recipients when the overpayments were the result of an agency error. So all of these recommendations in this proposal are based on the 2020 report that explored the impact of deep poverty on health outcomes. For the next portion, you'll be moving to page 22. The governor's budget includes a recommendation to change how the state calculates benefits for the MFIB program and general assistance. So if enacted, general assistance benefit levels and MFIB levels would be set using 6-month reporting rather than monthly reporting. This would allow for more consistent financial support to our lower income Minnesotans in the current system, which can cause fluctuations, and would allow MFIB and GA rules with SNAP and housing support, which provides greater administrative simplicity, as well as reduced paperwork for low-wage workers, as well as our frontline county workers who administer this program. Next, we'll discuss the governor's budget, which is creating a temporary 2-year expansion of existing community support services to serve an additional 5,000 households that have been unserved or underserved by previous COVID-19 relief efforts. This includes immigrant populations. It would include a multilingual statewide helpline to help connect people to community services and supports to ongoing pandemic and post-pandemic recovery period. The recommendations also include resources for programs currently administered by the Resettlement Programs Office at the department. And finally, the proposal includes funding for outreach and research aimed at addressing systemic economic barriers for children living in poverty. Next slide. The governor's budget addresses $5 million per year to expand the Family Assets for Independence in Minnesota program, otherwise known as FAME. This increase would be added to the current base level, which is only $325,000 per year. So with this addition, we would increase the lifetime financial match limit from $6,000 to $9,000, allow tribal nation nonprofit organizations to administer the program, include 529 college saving plans, and additional emergency savings accounts for unexpected expenses. Next, we're moving to page 26 for your reference. The governor's budget allocates $3.9 million in fiscal year 23 and $37.9 million in 24 and 25, providing additional funding for community action agencies and tribal nations to create community resource hubs to better connect families to services and supports. This recommendation funds physical locations that will support relationship-based, culturally appropriate programs and service navigation. These will be geographically distributed across the state, and when fully implemented, there would be over 100 community resource sites across the state. The next series will focus in on the governor's recommendations to include investments to childcare. For your reference, we are now moving to page 23. The first, the governor recommends increasing child care assistance program, or CCAP, rates to the 75th percentile. This is a federally recommended benchmark to ensure equal access to child care for low-income families. The next rate update would occur January 1st, 2025, and would be updated automatically with each market rate survey, which occurs every 3 years. CCAP serves approximately 15,000 families and 30,000 children each month. And so increasing this rate really improves access to affordable childcare for low-income families, reduces out-of-pocket expenses, and supports childcare providers with higher reimbursements. The governor's budget includes a recommendation to turn the child care assistance basic sliding fee program into a forecasted program. This would allow families to meet the income and eligibility criteria to access the program starting in fiscal year 24. Forecasting this program would ensure that families do not have to wait until funds are available to access the program, meaning that county waiting lists would be eliminated.
That's a big number.
Next, this proposal is designed to alter the definition of family under the Child Care Assistance Program. So allowing foster care families, custodians, and guardians, allowing these individuals to access child care basic sliding fee program to receive increased financial support for child care. And this would increase 2,000 families to be eligible for basic sliding fee child care. Next, we're moving to the top of page 24 for your reference. This proposal is for grants to support childcare providers experiencing financial hardship due to COVID-19 pandemic. This would extend the availability of the additional financial support for childcare providers after the federal funds made available from the American Rescue Plan are exhausted. There also is a component to extend funding for local childcare support services that were originally developed with the ARP funds, providing some technical assistance to childcare providers, training and recruitment of qualified staff to work in the childcare sector, and technology access and support assistance. We'll then move into the food support section, and we're moving to page 26 for your reference. The governor's budget includes $7 million in fiscal year 23, $5 million in fiscal years 24 and 25 for tribal nations and American Indian organizations to improve access to food security programs within tribal and American Indian communities. And this funding will provide support for tribal governments and organizations to provide access to culturally relevant foods, provide funding for technical assistance and other materials. This proposal is for improving and expanding food shelf facilities throughout the state for capital improvements. In many areas of the state, there are still no viable food shelf options, and the pandemic has really strained already underfunded food shelf facilities. This proposal will fund grants to be used for freezer and dry storage space, improve the safety and sanitation, and address the ongoing wear and tear of existing food shelves. The governor's budget.
Oh, Senator Benson. I'm sorry, we'll just
Yeah,
stop there for
no
a
problem.
second. Senator
That's
Benson.
okay. Mr. Chair, if it's okay I want to go back to the childcare question.
Yeah, please.
CCAP is 275 million, and I presume that number continues to grow over time. And then forecasting basic sliding fee is 476.6 million. How many other states forecast CCAP?
Ms. Brown.
Thank you, Chair, and thank you, Senator Benson. I'm gonna have to phone a friend here to ask. I don't think we know actually how many other states forecast basic sliding fee childcare.
Senator Benson.
And Mr. Chair, how many other states are at the 75th percentile?
Ms. Brown.
Senator Benson, Chair Abeler, that is something that we'll have to get back to you on as well.
Okay, I think for all
Senator
of these
Benson.
proposals, we need to have some understanding of how we compare to peer states, states in our region or states that you would consider our peers. This is a lot of money. And if I could, on the capital for distribution facilities, we've had a lot of money flow through. I say a lot in the kindest terms, to do food supports, and that included freezers, et cetera. When are we going to get some comparison of where we were pre-pandemic to what we spent before we start spending this next amount of money? I'd like some sense of the total spend for food support through the pandemic and what was supposed to be for capital, because I know we paid for that. And then what's our base for food support grants for meal programs? We do have some problems in the Department of Ed, which is not in this committee's jurisdiction, but having some global view on how much we're spending on feeding people would be really important before we decide to add more.
Senator Benson's had a question. Do you want to respond?
I would like the department to tell us what they've spent, what the base is for these programs
Sure.
before they ask for more money.
So, Ms. Brown, do you want to address that now or later when you can get all you want? So either way is fine with us.
Thank you, Chair and members of the committee. I will provide that information after. I appreciate the question, and we certainly can provide what we have spent so far and what we are looking to, as well as a comparison to other states. Thank you.
And just since we're on the topic, as that came up in the paper, $200 million running through the Department of Ed, which makes as little sense to me as anything. It seems like it should be health or human services that would be coordinating that, or even ag, which runs the SNAP program. And I'm sure that's a discussion that is going to be discussed at length. But and I was just thinking of putting in a bill just to move it all to us, and so then we could keep an eye on things. But so how much, so now, according to the proposal, we're going to enter the food grant business. Do we already, I don't need the number, but are we already involved as a department in food distribution in some way, besides, not counting SNAP, that's just money, but in terms of food? Do you know, Ms. Brown?
Senator Abeler, yes, we are. We do provide funding to food shelves and food banks through a contract with Minnesota Hunger Solutions, and have done that for quite some time.
All right. Senator Murphy.
Thanks, Mr. Chair, and thanks, Ms. Brown. As you are gathering together the answers to some of the questions about what we're spending, I would be grateful to also understand and appreciate, since I'm newer to this committee, where we are in terms of need. So I would love to know where we're spending, where the additional dollars have gone, and then how are we meeting the needs in childcare and in hunger in Minnesota. Thank you.
So I'm afraid we'll have to spend some time on this in our committee. So Ms. Brown, and maybe we have a joint committee with education and talk about food. I don't know, that'd be interesting. I'll have to talk to that chair and see if it's in, I don't know what time they meet, but anyway, so we're all about doing good things and making the money go as far as it can go. So anyway, Ms. Brown, you can continue. Thank you.
Appreciate that. Let's see here. So we were on, I think we were just finishing up this slide here on food support grants, and just acknowledging the previous request that we will include, not for this hearing, but for in our follow-up, the growth in need and our responsive with this proposal. Next, we'll move to our child welfare.
Oh, Ms. Brown, I just can't help myself. Just the capital for food distribution facilities, and I don't know if that's a bonding request or if it's just cash. Is it our custom to give money to fix buildings of privately owned places? These are like nonprofits, I suppose, and that's gone so well in the in the food deal. But is it our custom to put money into a private building that we don't own or control? Do you know that?
Thank you, Senator. This is one-time funding, really designed to help support the emergency food system. When it was designed back in 1970s, 80s, it was designed to be temporary, and so there hasn't ever been support to help promote infrastructure to move food shelves out of perhaps a closet and into a facility that could serve people more adequately during high times of need.
Yeah, I'll leave it at that. I'm just curious. And if they close up and you've put, $150,000 into a place with coolers and all, who gets the coolers? Anyway, you can continue on. We're doing pretty good for time, but go ahead and move to your next chunk, please.
Okay, so moving into, this will be for your reference on the page 24. The governor's budget includes a series of investments in child welfare with the goal of reducing the number of children entering the system and making prevention and family preservation the central focus. So these investments will better ensure that children who have entered the child welfare are more likely to remain safely at home with their parents, or if removal is necessary, placed into care with relatives or kin. So I'll highlight just a few items. The investment includes the expansion of a number of programs that are currently being piloted and have shown great success. This proposal includes investments to support promising prevention practices, such as providing support to community-based providers and developing and implementing parent mentor programs across the state. Also providing funding to counties and tribal governments, including grants to support lowered caseloads for caseworkers working with youth in extended foster care, payments for youth exiting foster care. Next slide is preserving American Indian families. The governor's budget adds additional staff to help support the Indian Child Welfare Act unit, providing adequate resources to the department to better ensure that ICWA is followed and that our tribal nations are supported. So just highlighting that this would help provide some staff support to address the non-compliance complaints and work through backlog cases that the department has received, to provide some support to develop tribal-specific policies and practices to respond to sex and labor trafficking of American Indian children, and to provide support to advise the agency on ICWA and the Minnesota Indian Family Preservation Act, MIFPA, with guidance for courts, attorneys, and guardians ad litem. The next section is a proposal to include funding for the Mille Lacs Band of Ojibwe Family Services to support the tribal governments planning to join the Minnesota American Indian Child Welfare Initiative. Once fully implemented in 2025, the tribal government will begin receiving child welfare cases from counties to offer culturally based services. These funds will provide resources to the Mille Lacs Bands of Ojibwe to hire and train staff to manage the growth in administrative and direct care as the tribe plans to prepare to join the initiative. And finally, for this last section here, the governor's budget includes investments to support the third phase of implementation to the Federal Family First Prevention Services Act, FFPSA. This recommendation includes funding for qualified individuals to retain their Child and Adolescent Needs and Strengths, or CANS, tool certification, additional staff to implement new or expanded prevention services, and provide ongoing child welfare training academy staff, as well as provide funding to operationalize the IT requirements of the Act. And that concludes the section for Children and Family Services.
Questions from members about this last piece? Ms. Brown, on that last thing, the Families First thing, we've spent a good deal of time on that, if you know that. Is there going to be some policy that's going to go with this phase 3, and is that going to be as controversial as the first 2 phases?
Senator Abeler, no new policy would be included, and I would hope it would not be as controversial.
Yeah, aren't there still some open pieces of that we put off, or am I forgetting that wrong?
There are, Senator Abeler, there are a number of additional components that we'll be working on over the next several years.
But not this year.
Correct.
Thank you for that news. Can you also just, throughout, and I don't even know the answer to this, so there's poverty. Can you just define deep poverty for me, and whoever else doesn't know that definition very well? I can kind of get the idea, but is there a definition of that specifically?
Senator Abeler, members of the committee, I'm going to phone a friend for the definition of deep poverty. We have a number of policy experts, and I believe a nice definition, if I can phone a friend for that. Jennifer Sommerfeld.
Well, Ms. Sommerfeld, we actually got you to this meeting. I'm pretty happy.
Yeah.
This is like bingo. Anyway, that's the one piece I was looking for. So welcome to the committee.
Thank you, Mr. Chair, members of the committee. I'm Jennifer Sommerfeld with the Department of Human Services. The definition of deep poverty is half of the federal poverty guideline.
All right. And is there a time frame for that, or they blink into it, or they kind of are there for a while? Do you just Because that could be transitory, and then they would no longer be in deep poverty, right? So it could be a short-term thing or a long-term thing.
So I can't answer specifically what's happening family to family, as Mr. Chair, members, whether
right.
are in and out of it, but we can certainly get back to you with more information on deep poverty. We presented to the House actually today. We have a great presentation that we can share with you about deep poverty that provides a lot of information.
Right, and I had a very enlightening conversation with the commissioner and some other folks some time ago. So, no, maybe we could even just provide that to the members. They could just read it over for their own pleasure and their own, not pleasure. It's really actually sad, but for their own understanding. So, any other questions to this section? Okay, let's move into licensing. The people have been home and waiting for this section in particular. Ms. Modi, are you starting with that? Or am I wrong about that?
Thank you, Chair. No, that is me, correct. Thank you, Chair Abeler. For the record, my name is Kalani Moti, and I serve as the Inspector General here at DHS. And the proposals I'll be talking about the first will be our critical resources for licensing. So the governor recommends providing funding to address growth in the number of foster care and home and community-based licenses and applications, and address the growth in the work related to our maltreatment investigations. From 2014 to 2021, there has been an 139% increase in the number of licenses that we have. Since the inception of our home and community-based services, or HCBS licensed services, in January of 2014, the number of service lines that may be licensed under a 245B licensure has increased from 19 to 31. We've also seen an increase in the number of foster care applications being submitted, and the number of maltreatment complaints that we receive have doubled over the last 6 years. Without additional resources, this increase in workload has caused license application and processing times to significantly increase, has greatly lengthened the time between HCBS licensing reviews, and has negatively impacted the timeliness of our maltreatment assessments and investigations. So this request would provide additional staff, and if funded, would give us the ability to reduce the amount of time it takes to process our HCBS and foster care licensing applications, reduce the time between the HCBS licensing reviews to at least once every 3 years, and to ensure statutory timelines for maltreatment complaints are met. Next slide, please. This next slide is a proposal for one-time funding to credit providers for the cost of emergency background studies conducted since July 2021. This funding request is similar to the request that was included in the budget last year, which gave a credit to providers for the cost of emergency studies that were conducted from April 2020 through June 2021. And just as a reminder to the committee, the department waived or modified several state background studies requirements during the peacetime emergency. And the studies that we had conducted during that time, we have termed as emergency background studies, and that was a fee assessed. So this would be a credit that would be processed back to the providers for the cost that they had outlaid on that. And with that, those were my two proposals that I am presenting on. Are there any questions?
Just keep going. We're going to run out of time. So fly through your section, and then we'll take questions at the end, Ms. Modi, okay? Thanks.
I'm actually done, and so I'll be turning it over, I believe, to Deputy Commissioner Chuck Johnson.
Oh, all right. So any questions on this this little bit? Just the consensus of our committee is that 43 FTEs for licensing seems like a lot of people. So.
Yeah, and Mr. Chair, if Ms. Modi could send us the backlog that is justifying the 43 FTEs, that would be helpful.
So you kind of woke us up on that one, Ms. Modi, so way to go. Any other questions? Okay, Mr. Johnson, why don't you come, you're the cleanup batter here, so. And they say you're the powerhouse, go out strong. So, Mr. Johnson.
Thank you, Mr. Chair. For the record, John serve as Deputy Commissioner of the Minnesota Department of Human Services. My slides will jump all over this one. It's on page 33 of the handout. If you look at the handout, this is a request for additional resources to the agency compliance process controls. When payment issues arose in 2019, Commissioner Hartsup took immediate action to address those issues. We also took steps to try to prevent future issues from occurring. putting in place a compliance framework, as well as focusing on closing audit findings and mitigating known risks. We also asked our Office of Continuous Improvement to implement Operation Swiss Watch to directly address Medicaid payment issues and grant contract issues, the big issues that have been identified in audits. This proposal will help strengthen those process compliance and process controls by addressing areas where we have some critical staffing needs now, and also expanding our capacity to examine and improve process controls into the future. Specifically, we're asking for 10 FTEs in our licensing division, 6 of these to keep up with the contract volume, which has increased dramatically. We've been using overtime essentially to try to work through those contracts now. The other 4 FTEs would really be devoted toward putting in place an agency-wide contract compliance monitoring function, including a contract database, which will allow us to track compliance on contracts. We're also requesting 2 auditors for our internal audits division. This is really part of our shift away from reactive auditing and into proactive auditing, particularly looking at risk-based analysis of program payments and rate setting and billing practices. And finally, really to help us going forward, we are asking for 7 additional continuous improvement staff. These are the black and green belts, the people who really help us examine the process and dig in to improve both compliance and efficiency. It's been a very valuable tool for us, our CI office, over time. We have many agency processes that are struggling to keep up with volume or clients. We believe the CI resources will help us sort out the best solutions and the best path forward to improve each of these areas. This proposal is on page 22 of the MMB handout. This is a proposal to fund plan toward move Minnesota toward a person-centered and integrated human services delivery system. This is a proposal that builds on work we started 5 years ago in partnership with counties and tribes to define a future vision for human services delivery system. 2019, you provided us with funding and support, and we said we'd come back and this is the plan that we're bringing back. The focus here is squarely on consumers, on improving the experience and the access to services for the people and families who are supported by human services in Minnesota, to make it easier for them to access services, as well as to find the services that they need from a holistic perspective for their family. Would also allow consumers more control over service navigation, including access to their own data. The foundation of this proposal is a set of recommendations from Gartner Consulting. We contracted with Gartner and basically said, this is the vision of where we want to go. Can you help us with a roadmap on how to get there? The roadmap and the recommendations that Gartner gave us are fully aligned with the approach outlined in the Blue Ring Commission on Information Technology report from 2020, and specifically the modernization playbook that group developed. Using human-centered design, using a product or agile approach to solutions, it's an incremental way to develop, add value, target pain points in the system, using a multi-vendor approach with an integrated platform, as well as ensuring that for success, we need to have the business functions in place. We need to have the appropriate consultation with all of our partners, particularly counties and tribes in our case, the governance decision-making, procurement, and vendor management capacity, things that we have to some degree now, but really need to build out, as well as on the IT side, cloud computing and DevOps capability. We have an example of what success looks like when we go this direction. That's called MN Benefits. This is a tool we launched last fall statewide. It allows people to apply for 9 of the cash and child care and food programs using an app that essentially reduces the time of application from 16 minutes to 12 or 13 minutes. It's mobile enabled, simple to use, has a Spanish version. It was developed working with a company called really in line with these principles, doing very frequent iterations and development, consulting at each step with county and tribal partners, as well as directly with consumers, letting them test and seeing what worked best, and making those improvements so we got to the level of expanding it statewide. Consistent with what we started and with our recommendations, our first focus will be on eligibility and enrollment. This touches almost everyone in the system, so we believe it's the best place to start. It's heavily technology dependent and full of pain points for consumers and for county and tribal partners. This proposal funds the Gartner roadmap, including the business capabilities to successfully execute the scope of modernization. It includes funding enhancements for MN benefit, support for organizational change needed to move to a product agile approach, cloud computing technology support. It also includes continued investment in our current systems, which we need to maintain as we're going through this process. And sustain legacy systems while investing in other gaps within our IT infrastructure to help us ensure we keep services moving people. This is, as you look at, a large request, $77.5 million, and it is a big IT proposal, but it is so waivers in Minnesota.
Mr. Johnson, Senator
Go to
Benson.
the next slide.
Oh, no, let's just wait on that. Senator Benson.
Yes.
Thank you. Commissioner Johnson, the 68 FTEs, is that to build the IT system, or how do the 68 FTEs, because I would think if we were building an IT system, we'd get outside experts to come in, do the work, use commercially available off-the-shelf software, or the folks from Minute would come in and do the support. So 68 new DHS employees, are they permanent?
Senator Benson, they only have 700 doing that already. 711
I
is the
guess
last number.
that's
So,
my
Mr.
question.
Johnson.
Do they go away at some point? Because if we're supposed to be improving service and using IT to be more efficient, I would think an FTE reduction would be at some point in this plan.
Mr. Johnson.
Mr. Chair and Senator Benson, it's a fair question. Most of those FTEs would be temporary in nature while we're going through this process. They are on the DHS side. This is mostly in alignment with recommendations both from Gartner and from the Blue Ribbon Commission that we need to build out business capabilities in order to successfully do this scale of modernization. Some of the stuff that we kind of have not done very well in the past, when we focus on the IT side and deliver a system and find that our business partners aren't ready to work with that system, or that we haven't carefully thought about how to change business processes in order to accommodate what the new system's capabilities are. And doing a better job of that work up front, we think will be, in the long run, make us more successful in delivering better services to people.
Senator Benson, and so you can please
you.
follow up, and then we're going to quit at 2:45. So
I'm going to go, I'm just going to really fast, I'm going to make a statement. Commissioner Johnson, I have asked for 5 years that when the IT projects come forward, you bring recommendations to the legislature about things that we can reduce and streamline so that we don't have to custom build all of our IT systems. Not seeing those. And so you talk about working with business partners. The legislature is a partner, and pre-pandemic, I saw a giant, like folks, you would not believe how big the sheets of paper were describing this IT system, and that's the last we've really heard of it. So if you want to be partners, then we're going to have to be at the table, and there's going to have to be more transparency than 68 FTEs.
So, Senator, Mr. Johnson, if you could just go real quick through the treatment record. You can tell us you're going to legalize marijuana. We're not going to discuss that. And then 30 seconds on TANF, and I have a comment, and members will make their final statements. Okay, so 30 seconds on the electronic health record, and if you will, so because we're going to wrap it up here. There's another committee coming in. Mr. Johnson.
Yes, thank you, Mr. Chair. This is on page 34, and Senator Benson will get you a breakdown of the FTEs. This is to enable our director and treatment to have a fully compliant, fully functional electronic health record system. We don't have one right now. The Department of Health set a timeline for entities to have electronic health records by 2015. We have been working using operational funds, but really need to accelerate and complete the development of the system. I have a list of inefficiencies and to care that happen from not having a fully functional electronic record that I can share with the committee in some point. It'll be part of the budget page you receive. To save time, I won't go through it now, but we are requesting additional money to ensure that the director to what they need, which is a fully functional health record.
All right,
Mr. A couple of other proposals.
Yeah, go ahead.
Yes.
I'm just gonna, I
Couple
mean,
of
My Little
proposals
Dinky
to
Clinic
run
has
through.
health records, so I'm just wondering why we're still talking about that, but that's a different discussion, so keep going. Mention the cannabis, just that you're gonna do that, and then move into the TANF part. That's probably more useful for us right now. The cannabis discussion could go on more than, 2-3 minutes. Mr. Johnson.
That's right, Mr. Chair. On page 30 of the handout that you have, as you're aware, the governor's recommending safe and responsible legalization of cannabis for adults. Our budget items that hit excuse me, the Department of Human Services Substance Disorder Advisory Council, which is a relatively small cost to begin with, but has $4 million per year grant funding in 24 to begin grants by the council. There are also activities for expungement related to changes in law the governor's proposing around cannabis that would create needs within the background study area, a little over $1 million the first year and about $2 million in the tail.
Okay, so now do TANF, please.
And then finally, the governor's recommending TANF to pay for working family credit, $26 million per year over the next 3 years.
Yeah, it's amazing, and I just saw him in the hallway. Senator Murphy, Steve Swigum, when he refinanced TANF to buy stuff, it was considered to be a bad idea. So anyway, how about that? Anyway, so Mr. Johnson, I appreciate you there saying this. Any other? And so does anybody else want to say anything? We have, a minute for people to say something if they want, but I mean, this is clearly, aspirational budget. I am just very concerned that the $7.7 billion is not going to be there. And with the ups and downs, we've got $65 billion come into the state that had to generate some sort of synthetic activity, which is taxable. And I'm just very nervous that if we add all these programs, when the money goes down, what are we going to cut? And a lot of us have sat through cut times, and it is not fun. So, but to the department and the public, you will see this committee to be willing partners to discuss the best things for Minnesota, try to find our way through this workforce crisis and the other crises facing all these families. Thank you for all the committee people and for everybody's good attention. The highlight of the day, the recodification got moved out to the consent calendar. That is a noteworthy event, which will stand the test of time. So see you on Thursday. We're adjourned.